Hello, this is Dr. David Greene, CEO of the Florida Pain Network. The topic today is the indications for spinal discectomy surgery for sciatica. At any one point in time, 1 to 2% of the population suffers from sciatica. Most people have no clue at all what they did to spark it up. It's typically due to a slow disc degeneration that results in a tear of the outer covering of the disc and the inner part squeezes out. And this may culminate with something like a sneeze or picking up something small off a table. It doesn't have to be a big-time car accident. Well, the symptoms result in pinched or irritated nerve root that gets inflamed and causes any one of these. Leg pain, could be a burning sensation, pins and needles sensation, possibly some numbness. Sometimes weakness occurs, and then rarely do you get incontinence of bowel or bladder. Initial treatment should consist of a short period of bed rest, up to 48 hours, and then over-the-counter medications as well, including anti-inflammatories and Tylenol. Physical therapy, chiropractic treatment, spinal decompression therapy has been shown to be very helpful. Prescription medications may include a Medrol dose pack, which is a burst of prednisone for a few days, narcotics, muscle relaxers, and possibly neuropathic medications like Neurontin or Lyrica. Interventional treatments that have been shown to help may include trigger point injections along with epidural injections, such as you see here, where steroid is injected right around the area of the pinched nerve. So there are 3 types of indications for surgery: absolute, relative, and then quality of life. So when you start looking at absolute, that means you got to have surgery, or there are dire consequences. And that's an indication called cauda equina syndrome. So basically it results from compression on the area that's a remnant of the spinal cord. So effectively the spinal cord ends around here, L1, T12, okay? And then you have what's called the cauda equina. And when that gets compressed, like you see here, very large disc herniation pushing on the central part there, it can cause irreversible incontinence of bowel and bladder and difficulty walking if it's not treated very quickly. Most people say within 24 hours it needs to be corrected. Okay, so that's an absolute indication. Now, a relative indication would be if you have some motor weakness or a neurologic deficit that is progressing. So if you start having, say, difficulty lifting up your foot, which is typically due to compression on the L5 nerve root, and if it's getting worse and not getting better, that would be a relative indication for surgery. You can watch that for a while. We don't know exactly how long in any particular person you can watch it, 6 weeks, 3 months, 6 months, but at a certain point, even with surgery, it's not going to get any better. Okay, so you got to be very careful with how long you continue to watch it. When you start talking about elective quality of life procedure, that means a person who's had 6 to 8 weeks of conservative treatment and it's just not getting better. And it's not weakness, it's not cauda equina, it's just pain and numbness. And the treatments that we tried can be exactly what we talked about before: medications, PT, chiropractic, spinal decompression therapy, injections, and none of it's working. So the person might say, I'm just going to opt for surgery. Now, less than 10% of people actually end up needing surgery. Over 90% have good to excellent results with the surgical procedure. But a landmark study in 2006 showed that there are identical outcomes at the 1-year point, with or without surgery. The only thing surgery did is it helped increase mobility and decrease pain faster, so help people get back to work faster. The top non-operative pain management in Florida is through the Florida Pain Network. There are many clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. In the Tampa area, visit us at painmanagementtampa.com and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Greene with the Florida Pain Network. Your pain stops here.